I did not want to be a doctor when I was a kid, although I was interested in healthcare to a degree because I was fascinated by the human body. You know, it's everyone's right to pursue that ability to have the most active lifestyle possible. And I want to be a part of that, and I think that's cool if I can play a small role in that, where I'm actually going to help someone's quality of life improve.
I worked at a summer camp for as a counselor for diabetic kids, and the purpose of the camp was to teach kids, these are insulin-dependent diabetic children, how to live a normal life. And the physician at the camp who was really helping these kids with their daily check-in happened to be a family doc. And I realized at that time just how cool that was, what he was doing, to really look at the whole, like the holistic picture. Really the physical part of things, the social aspect of things, there's a spiritual aspect to health and wellness and all that. And I saw how, as a family doctor, he was really able to do that with these kids and their families, and I was hooked.
My biochemistry advisor told me I would never make it, I shouldn't apply. Dad didn't believe in me. I was like, game on. So I started my first few years and got into the clinical side of it, and found that I loved family practice. I love having the babies and the grandbabies and the aunts and the uncles and the moms and the dads and from both sides, and that relationship that you develop with all your patients.
We really run this place more like a community of faith and practice as opposed to an actual business. And when I say a community of faith and practice, when I say faith, I mean it as a secular construct of positive beliefs and positive predictions, combined with inspired action leading to positive results. And at the core of that positive belief system is the knowledge that medicine can sometimes cure, but relationships can heal.
There was a time where, I was the doctor. I would come in and say, I'm the doctor, here's what I'm telling you to do, here's a piece of paper, a prescription for you to fill to help you do that thing I'm telling you to do. And those days are long gone. Now it's all about partnering with patients and patients understanding what the decisions are, and we have something called shared decision making. That's exactly what it is. And then also partnering with the different members of your team.
I love the team model. I love being able to take a patient in distress and be able to walk down to our counselors, or a patient who's struggling with vertigo and take them to Teddy for physical therapy. Using our pharmacists to help us with difficult med decisions is outstanding. So I think integrated care is a powerful tool that should only be present from here moving forward.
When I see a patient, I will ask about their podiatry visits that they had. We have podiatry and PCHC, or if they've gone to the dentist recently and had to have some work done, I'll inquire about that as well. Because it's looking at them as a whole person and not just one little piece of that puzzle.
We work together, we collaborate, we discuss the patient's needs and how to meet those needs. Sometimes we do visits together. And so that's integration, is really truly working together for the good of the patient.
And I really think that's kind of neat to see someone change in a short period of time, where you go from coming in a lot of pain, dysfunction, and not being able to do much, to actually taking up a hobby again, and people finding their passions again. So
we're a family to a lot of these people here at the Hope House and outside of here. I wish they knew that it is entirely possible to get better and that relationships can always heal.